with Applied Behaviour Solutions. My name is Robin. I know your time is valuable, so every Tuesday we release an episode loaded with quick tips designed to get you in and out. In this episode, I want us to explore what anxiety in children looks like and how we as parents, teachers, and other professionals who work with children can help ease this on a daily basis. For those of you just who are joining us for the first time, I'm a co-founder and director of Applied Behaviour Solutions. Our goal is to create a community for parents and professionals who work with children that have unique support needs. We use a multidimensional approach to unlock our kiddos' potential. We create individualized programs after doing an in-depth assessment based on their support needs. Our behavior technicians then work with them on a one-to-one basis, at home, at school, in the community, whatever they may need. We use the principles of ABA, which is Applied Behavior Analysis, to teach our clients new skills and build on skills that they already have. We have worked with a variety of kids with different disorders, such as autism, ADHD, ODD, Down syndrome, learning disorders, and more. I'm a behavior analyst. I design these programs and supervise cases, and I've been working with children who have special needs for going on 9 years now. So getting back to our topic for today, we are in a global crisis, and just as much as we as adults have felt the stress and the added pressure that comes with it, our kids are feeling it too. The difference is that children don't have the same social, cognition, executive functioning, and communication skills to deal with their emotions like we do. So the whole point of this episode is, what can we do to let our kids know that we are here to support them, and so that they know that how they're feeling is okay. So I want to just talk more about what anxiety is, especially in our kids. And then after that, I'm going to give you some helpful tips that you can start straight away with at home. Just a quick note, while we're live, I will answer any comments or questions that you may have. If you're watching this only afterwards, don't worry, just pop a question into the comment section and I will answer it straight from there. All right, so anxiety isn't always necessarily a bad thing. It helps us respond better to threatening situations. It helps us plan for the future. There is such a thing as healthy dose of anxiety. Well, not anxiety, just it preps us, right? So anxiety only becomes a problem when it negatively affects your relationships and it causes significant distress in everyday life. So anxiety also has a high comorbidity with many other disorders such as autism. It's not a core characteristic of autism, but studies have shown that around 40% of children with autism have elevated levels of anxiety. Like, that's a lot. That 40% is a lot. Different forms of anxiety can become present in our children. And they can develop specific phobias, they can develop social anxiety, they can develop separation anxiety, to name a few. One of the defining features of autism is an anxious and obsessive insistence on sameness and daily routines. And any disruptions to these routines can cause a lot of anxiety. Recognizing whether your child has anxiety it can be really difficult, especially when there's a diagnosis, which may mask these symptoms. So again, if we look at autism, for instance, this anxiety may increase repetitive behaviors. It may lead to further social withdrawal, the development of depression, aggression, and in some cases, even self-injury. Many children who have autism also have communication deficits, which means that they will not always be able to verbalize their fears and anxieties. And as a parent, this is horrible to watch. So the key thing here is, the earlier you pick it up and begin to treat it, the more emotionally grounded and less anxious your child will be. So it's really beneficial for children to learn how to be flexible because life is unpredictable, like a lot of us know. Change is inevitable. So it is still important to have routines in place for kids, but they do need to be able to cope with change in a way that isn't harmful to them or to others. Whether you go a pharmacological route or not, behavior intervention is strongly recommended. So applied behavior analysis, ABA, and cognitive behavioral therapy, so CBT, can be helpful in identifying your child's triggers and teaching skills that help your child find relief from and replace these compulsive behaviors and other symptoms of anxiety. All right, so let's now quickly jump into what you can start doing at home today to help your child. All right, so number one, create a set but an adjustable schedule for them. Okay, so this will show them what their day is going to look like. A lot of children find it comforting to know what to expect and to be able to see it. Visually, kids are visually strong, so it will help prepare them for any changes that may be occurring on that day. So what you can do is you can put the schedule on a wall in the kitchen, in the dining room, in their bedroom, in the bathroom, have a copy of it in their homework diary, anywhere that you know that they'll find it easily and can refer to it. So if you are going to the dentist that day, you can have the schedule of the waking up in the morning, having breakfast, going to school. Oh, and here, mom is going to fetch you from school, and we're going to the dentist. And when you get back from the dentist, we're going back to school. After the dentist, we'll go back to school, and so on. It depends on the child, like how many things you would like to place on the schedule. With kids that have a stronger communication, with communication, you can ask them. You can have a discussion with them with what they need to be seeing. You'll also know your child a lot better and know like exactly what it is they need to see. Just one thing is just a reminder to put in things that they enjoy on that schedule as well. So not to only put like the things that could change, so that they can see, okay, so I'm going to the dentist, but after the dentist, before going back to school, mom is taking me to the shops and I can get a packet of chips. Place that there, let them see what they have to look forward to as well as what they need to get done during the day that they don't like so much. Right, tip number 2, tell them stories of where the main character is struggling with some of the same challenges that your kid is struggling with. So that they know, okay, it's okay to struggle and there are actually ways out of this. And everybody actually has struggles during the day and it's fine. What I would recommend highly, and we find that this works really well, is what we call social stories. So a social story is a visualized story of how this thing that they're not really comfortable with or they don't know, it's a story representing how that's going to play out and what they could do. So with a social story, what you want preferably is each page is 1, maximum 2 sentences with a concept and a picture. So you can make these yourself. There are plenty online. You can Google social stories, and there are a lot of printable ones. But what I find works best is to make specific ones for your child. So let's say your kid struggles to have conversations with other people without getting anxious, right? So you would title the story "Talking to Friends," and you would say, okay, so I like to talk to my friends, but sometimes I get nervous. Then your next page could be, when approaching friends, remember to wait for a natural pause in the conversation, or here are some topics that I could talk about when I want to go and talk to my friends. Remember that different people like different things, and if I'm talking to a person who loves Harry Potter, I can bring up Harry Potter. If I'm talking to, so you can really build in whatever you want to in these stories, and almost like a teaching guide to them. It could also be that, let's say you're moving house and you want your child to be prepared for that. So you would put that into a story, moving house, where you could detail all of these things that are going to happen so that they're prepared for it, and they're more accepting of it when it actually does happen. And they also have the skills that they need in order to overcome some of the obstacles along the way. You could even use pictures, real life pictures. So, for example, the one about moving house, take photos of your actual house, take photos of the new house, put it all there so that it's relatable to them. Just I can't stress enough that this works so well with so many kids, and I really do recommend it. Right. Oh, and for the social stories, read it a couple times a day, not just once. It's not a story to be read once. Read it. When I run this with my kids, when I put it into a program, I recommend to read this every hour so that they just get used to it. I mean, it's that, okay, this is going to happen. And eventually, when it does happen, it's almost like it's not a big deal because they've prepped for it, right? So, tip number 3, make subtle changes where possible in your everyday life, right? So you want to do things that will encourage flexibility. So whether you are driving to school every day, take a different route. Or if your kid is insistent that every Tuesday night is pasta night or spaghetti night, change the pasta that you use. Like little ones. You don't want to go in all out in the beginning and start changing things. It will dramatically change their day. You want to start with little things just so that they can get used to, oh, look, you were expecting this, but this is what happened. Is it a big deal? You can talk to them about it, or you can just do it and just increase the amount of times you do it a day as they become successful with it. Increase the intensity of the changes as they become successful with it. This is particularly effective for children who have autism and who naturally crave fixed routines and can't handle these routines. I feel it's important for me to say that we are not trying to change our kids by doing this. We are trying to help them for down the road when these changes are going to happen. I mean, we're in the middle of, like I said earlier, global crisis. We did not predict that we would be working from home. We did not predict that we wouldn't be able to go to the shops when we went. Like, these things happen. And if you don't prepare your child for it, when they do happen naturally, and they will, they are not going to be able to handle it. They will go into, it will just, and what anxiety does also is it prevents you from learning. So everything you're trying to teach your kid while they're feeling that anxiety, and it could last weeks, is gone. So we're not trying to change the child. We're just trying to help them for future instances where this is going to happen. Again, though, start small. You don't want to create huge changes in these kids' lives to start with. Start small and work your way up. Right, number 4. Prepare them in advance when big changes are going to happen. So when you know that really big things are going to happen, like moving house or going to the dentist, or perhaps the night before you know that the teacher is sick, the one that they're used to, and there will be a substitute teacher, let them know. Give them time to prepare for it, and give them coping strategies. This is a good time to use a social story. Okay, so this is going to happen. You can have a calendar or any kind of visual representation of when it will happen. So like if you have a family where one of the parents, one of you are traveling and you are about to leave for a week, prepare them for it. Let them know what they can do when it does happen, and how long it's going to happen for. So I think for the big changes where you can, like for lockdown, there was at least a week's warning or a couple of days warning that we had. Prepare your kid for that. It's a big change. It shouldn't just be sprung onto them. I mean, even us as adults, we like to be notified when things are about to happen. All right, the last thing that I would say that you can start doing from today with your kid is give them appropriate alternative behaviors to decrease their anxiety, right? So if you have a child who, while they are feeling this anxiety, and it is going to happen, even if you follow all these tips and every other tip, there are going to be times when your kid gets anxious. It is natural. We all get it. As adults, with the correct coping strategies, we know what we can do to make us feel better. So help your kids do the same things. If your kid is typically a kid who will start screaming and punching and throwing things and breaking things when they're feeling like this because they don't know how else to get rid of that energy, teach them how to. Teach them what else they could do. Teach them to scream into a pillow, to punch a pillow. One of my favorite things, and I put this in a lot of my kids' programs, is to create a destruction box, right? How many of us love to just like, oh, you just want to like break something, or a lot of us don't. We have the inhibition to stop it, but some of our kids don't have that same inhibition. Create a destruction box. It's a box that is placed in strategic places around the house or in the car or wherever it is that it's likely to happen that they can just break, right? So paper, they can tear it, newspaper, clothing that they can rip, sticks that they can snap, anything that will give them that satisfaction of breaking something. Have those destruction boxes around the house and teach them that, okay, you are feeling like this right now. What will help you is if you go and do this, if you go and break your, like, so go to the box and they go to the box. Or you can teach them, have their own fort or private like little space that's just theirs, and they can go in there and they can scream and they can do whatever they want to in there. If it stops them from hitting their siblings or acting out in a way that later on they will regret or that is harmful to other people. So start teaching them those emotional coping skills. That is going to help them when they do feel anxious. All right, everyone, I hope that this has been helpful. It's my goal to be brief, to be detailed, and to be done so that you can get back to what you need to be doing. And we're done. So tune in next week for another episode of Quick Tips Tuesday. And don't forget to follow us on Facebook and Instagram to watch this later. We also have a whole bunch of resources that would be helpful for you and your children going forward. All right, bye, everyone.